Good evening to one and all present here. We will shortly begin this webinar. This month's theme is on breastfeeding matters, building supportive ecosystems for mothers and babies. We at Nurses Labs welcome you all here for this online platform. Do follow us on the WhatsApp channel for more updates, posts, and webinars such as this. I would like to introduce our speakers for this evening. Our first speaker, I would like to warmly welcome Dr. Sudha A. Reddy, Assistant Professor, College of Applied Medical Sciences, Department of Nursing, University of Bisha, Saudi Arabia. Ma'am has completed her UG from the College of Nursing, AFMC, Pune, her postgraduate from KLE Institute of Nursing Sciences in OBG Nursing, Belgavi, her MPhil from MCon, Manipal University, and PhD from National Consortium of PhD in Nursing from RGUHS Board. Ma'am is a master trainer for virtual capacity building program for midwifery faculty organized by the INC and UNPFA, and is also a master trainer for Helping Babies Breathe HBB program. Ma'am is a principal investigator of UK IERE project between University of East Anglia Norwich, UK, and the KLE University, Belgavi, and has visited UK twice between 2014 and 2015. Ma'am is a principal investigator for funded project on mental health for postpartum mothers with the Thomas Jefferson University, Philadelphia, USA, and the Southern Cross University, Australia, for developing an M-learning app for UG students and communication skill management of chronic disease. She has organized many international and national conferences and workshops. She has a total of 32 international and 17 national publications in her credit. She is a member of the academic bodies and BOS of various universities, PhD guide and examiner. Ma'am manages dual role at hospital and nursing colleges. She's an advocacy committee member at the ANEI, that is the Association of Nurse Executives of India. We welcome you, ma'am, and over to you.
Thank you so much. Good evening, everybody. I would like to take this opportunity to thank the Nurselab organization and especially Tanya and the team and the fellow resource persons with me today, Professor Madhushila from Narayan Vidyalaya, the Vice Principal, and Ruth Patterson, lactation specialist. A very important role she has, I think, for this session in this theme, and that is breastfeeding matters, building supportive ecosystem for mother and babies. Today we'll deal with the breastfeeding supportive strategies. We have two more important sessions after me. Like we all know, breastfeeding means we know it's so easy, especially when you do undergraduate research projects, master's thesis, knowledge, attitude, compliance, knowledge, and attitude. It's so common to do studies, and people sometimes criticize what is this study, do some randomized control trials, do this, do that. But this basic study to identify the gaps in the knowledge, attitude, and practices regarding breastfeeding among the primary mothers, multi mothers, healthcare workers is such a basic, important topic which we all really need to probe on, think about it, and continue doing it in spite of all it looks so common. When we talk about the breastfeeding, uh, when we talk about the deep latch, that is a key point here. Deep latch for the newborns is that feels comfortable and protects milk support. And what is this deep latch? A proper latch is very important for effective breastfeeding and preventing discomfort or injury to the mother's nipples. So we all, those who have been mothers, those of us who have been going with the students in the maternity wards, we feel, we always see that it's so difficult to motivate a mother, or even if she's motivated and she's facing some problems, when you succeed in establishing successful breastfeeding along with your students or your staff or your lactation consultant, that feeling of satisfaction is so great. So simple key points here are positioning, the cue and readiness of the baby, the mouth placement of the baby, and what are the signs of a good latch which you can identify. So when you look at a good latch, proper breastfeeding position and latch on, you should hold your baby with her whole body facing you. So just hold your baby and turn the whole body of the baby towards you and place your baby's nose and chin against your breast. And what I mean here is like I'm talking to the mothers, like I'm asked in this presentation, if you teach the mothers, place your baby's nose and chin against the breast, support the baby's head, neck, and back, and the baby should draw both the nipple and areola into her mouth. Actually, three-fourths of the areola should be in the baby's mouth, and the lower lip should be turned outwards. So, these are the WHO points, important points, which show a proper latch. And on the basis of this, we have the latch scoring. And when you look at the latch, you know that a good latch is usually pain free and feels like a gentle tug rather than sharp pain when the baby starts suckling the breast. And there's a rhythmic sucking, and you hear swallowing sounds. The baby is sucking and also swallowing. And any discomfort, if you feel, gently relieve the suction by placing a finger into the corner of the baby's mouth and reposition it appropriately. Other than the proper positioning is also very important, where you position first of all yourself and the baby comfortably. When we go for postings to civil hospital, government hospitals, my experience has been we don't get pillows. There's only one pillow which is hid under the bedsheet because there's no pillow cover. So if you have enough of comfort measures, if you have a pillow where the mother can lean back on the bed, keep a pillow under her leg, she has undergone an episiotomy and the baby is rested, all this uh, enhance the rate of successful breastfeeding. But in the given situations, we have to improvise, modify, and try to see that the mother is positioned and the baby is comfortably placed. The common holds, that is the cradle hold, the cross cradle hold, and the football hold, are the most popular positions. And also ensure that the baby's body is always aligned. Then, when you talk about cues and readiness, what are cues and readiness? Like, how will the mother know my baby is ready? My baby is giving me cues. I have to feed the baby. And these are like your baby will tell you themselves they are hungry. Like, what will the baby do? Baby will be bobbing their head or turning and opening their mouth. It will be wriggling and clenching their fists. They will put their hands near their face or chew on their fingers. And sometimes they will be licking their lips, opening and closing their mouth, or making sucking noises. We, as primary mothers, we feed the baby, then we are busy talking to our relatives, doing other chores. But sometimes the baby gets hungry too soon, and baby tries to show a lot of cues and readiness, but we are not able to identify it. When do we pay attention to the baby? Oh, when it starts crying, that's too late. So crying is actually a very late sign of hunger. So look for other hunger cues so that you can put your baby to the breast while they're calm and they're ready to feed. So there are, we all know about the reflexes. There are other cues like look for hints that baby is ready to feed, such as the rooting reflex, where they turn their head towards the breast, sucking motions, or putting their hands in their. When you talk about the mouth placement, gently touch baby's lips with your nipple to get them to expand their mouth wide. Sometimes the baby is so hungry, not able to concentrate. So just try to gently guide the baby, touch the baby's lips so that it tries to at least keep the mouth wide open. The lower lip is turned outward. Then aim for a deep latch where the baby will take not just the nipple but also a good portion, three-fourth portion of the areola as well. And the baby's lips should be flanged out and their chin should touch your breast. So these are the placement of the mouth. If the baby has a shallow latch, see the lips are not placed well, and the areola is not covered completely, then it's very painful for the mother. It is very ineffective for the baby. Baby will swallow a lot of air, baby will not be satisfied. Whereas if you have a correct deep latch, then it is painless and effective lactation. They always say, oh, breastfeeding is very easy. Breastfeeding will take time and practice for both mothers and babies. And many mothers experience a lot of challenges with breastfeeding. but you need lot of support which can help overcome these issues. Many of the students have done UG projects. One of my students, masters, she did on knowledge and confidence. So we checked out for a knowledge, anxiety, and confidence. So we had a Jung's anxiety rating scale, and from Jogan, we had taken a standardized scale written to the author, and knowledge, anxiety, and confidence regarding breastfeeding in mothers. We had done a study. So there are a lot of challenges which we need to identify, and breastfeeding will always remain a research thrust areas to improve the quality of care for the babies and have a very good quality breastfeeding time for the mother and baby. So lots of challenges. If you feel that only uneducated mothers who don't know will face these problems, no. When I was a student in FMC Pune, I have seen the wife of a doctor, PG, who had to undergo incision and drainage because there was mastitis. We will definitely come to that topic and I will talk about it later. But breastfeeding is not easy. Breastfeeding takes time, practice, both for mothers and babies, and lot of patience on the part of the healthcare workers. Now, let's talk about pain and damage. There should not be any pain when the baby is successfully breastfeeding on you. But nipple pain is often due to improper latching, and adjusting the latch or trying different breastfeeding positions can reduce this discomfort. Sometimes nipple shields can help protect sore nipples. Many of us have experienced how much ever educated we are. We may be a midwifery teacher or tutor, but all of us have faced these problems during breastfeeding, sore nipples, blood coming out, the baby biting hard because you're not properly giving a latch to the baby. So nipple pain, if you look at a visual guide here, the normal nipple shape and color is unchanged after breastfeeding. So normal nipple, primary and secondary areola, it's not changed after breastfeeding. But if you look at a shallow latch, you will see the nipple tip is squashed, crushed after breastfeeding. And sometimes if the baby has a tongue tie, he or she is also not able to catch hold of the, construct a latch correctly. And if the nipple is very bright pink, it indicates a thrush. If nipple color changes to white or blue, there can be vasospasm or Raynaud's phenomena. Those of you who med search people must be knowing what is Raynaud's phenomena. It's a peripheral vascular disease where smooth muscles of the artery was involved. Same way in the breast tissue also you have smooth muscles. It may give rise to vasospasm or pain and give rise to discoloration due to reduced blood flow. Now, talking about breast engorgement, the most common, the most dealt with problem in mothers, it will typically occur in the early days of breastfeeding, usually between the third and the fifth day after delivery, as the milk comes in and the body adjusts to the baby's feeding needs. While some degree of breast fullness is normal during this period, but severe breast engorgement can be quite painful and may even interfere with breastfeeding. So if you see a non-engorged breast, it is very soft. There's no lumps, there's no hardness, there's no temperature, you know. But if it is an engorged breast, then it's very engorged and it is full, hard, and painful for the mother. The pressure can cause damage also to these cells. So, what are the symptoms of breast engorgement? Swollen breast, hard and very painful breast, fullness feeling, heavy and very tender to touch. You have warmth and throbbing pain because engorged breast may feel warm and have a throbbing or aching sensation. The veins are visible. You have visible veins. Increased blood flow to the breast can make veins under the skin more noticeable. And of course, there can be possible low grade fever. Some women may experience a slight fever along with engorgement, which is also called as milk fever. How do you manage the breast engorgement? Frequent and effective breastfeeding is the key or the mantra to avoid engorgement. You allow the baby to empty the breast, provide warm compresses before feeding, which can soften the breast and make clutching easier. Cold compresses between feeds can help reduce swelling and pain, and use pain relievers, ibuprofen or acetaminophen sometimes if they have severe breast pain, that will help reduce the pain and ease the breastfeeding and also reduce the inflammation. Supportive bras are very important. Wearing a well-fitting supportive bra can provide comfort and support. And long back in 2000, when I went to AIMS to undergo a training for the neonatal resuscitation program, we had a complete module where they really taught us, they taught us how to knead the breast in primaries from all directions. You hold your hand, warm your hands, hold your fist tight, knead like how you knead the wheat flour, knead the breasts from all sides, so that all the milk uh, enters the from the lactiferous tubules, enters the area under the areola, and you're preparing for lactogenesis. Another thing which we were taught was massaging the woman's back. So, but the action of massaging up and down, sliding your hands up and down across both sides of the spines would help in releasing, stimulating the pituitary gland and releasing oxytocin, which will cause the milk ejection reflex. So, these were the two things which I usually used to make my students practice, and they really worked out. So that is for enhancing normal blood flow, milk flow, sorry. So these are the different things. I was talking to you about a PG whose wife was very educated, and she was a primey, and she came with breast engorgement. We tried to give warm compresses. We felt it was hard since we were students. We showed our senior staff that it's very hard and lumps are there. She has fever. What to do? Then they took her for incision and drainage, and lot of pus and blood came out. She had to undergo dressings, and she couldn't feed from that breast. It's so painful, breast engorgement. If you neglect it, it causes severe pain, and it lowers the confidence of the mother to breastfeed. From that affected breast. And there's so many cultural practices. If you look at breastfeeding, people give lot of fenugreek seeds, so their chutney, warm water baths, oil massages, and in some cultures during bath, if there's lot of milk being produced by the mother, they even try to remove it. So there are different practices, and a lot of research studies. I think in under Rajiv Gandhi University till now, maybe more than 200, 300 repeated master's research project has been done on application of frozen cabbage leaves over the breast to reduce inflammation. Application of jasmine flowers, because when I used to go for exams, I would see so many theses and good, like evidence based practice. If they can really help, it's good that we explore newer things which can help the woman transition through a normal journey of breastfeeding. So, what are the common concerns among low milk supply? So we know improper latch, we know about breast engorgement. Now let's look about the common challenges, like why low milk supply. Concerns about insufficient milk are common. So ensuring frequent feeding and consulting again with Ruth, a lactation expert, can really help boost milk production. So when you look at this triangular diagram here, there are three main causes of low supply of breast milk. One is preglandular cause, where there is an underlying health issue. Then you have postglandular cause, where there is not enough breast stimulation or milk removal. This is easiest to fix. And then you have the glandular cause, where there is reduced glandular tissue or previous breast procedures, if any, done. Suppose a woman underwent a IND in one pregnancy. Again, she's having problems with feeding. So you can explore CA breast, certain things which may cause this. And can you see where this intersection happens between preglandular and glandular? This is where needs the professional support and guidance of a lactational consultant, a midwife, nurse teacher, mentor, preceptor, who goes with the students, who can guide them and help the mothers uh, undergo a successful lactation counseling program. So the common challenges of low milk supply, other like if there's a delay in initial breastfeeding, if there is no or very little skin to skin contact definitely causes that psychological feeling of, oh, my baby, I was waiting for it to be born. So cute it is. You think of it, and then milk rushes into the lactiferous tubules and just ejects out of the uh, areola and when the baby sucks. So skin to skin contact is very important. And you must have seen that famous video in Maharashtra in Gadchiroli, how the breast crawl is there, how the baby climbs up blindly, tuku, looking for the breast, grabbing the nipple and suckling. And no or very little skin to skin contact can delay milk supply. A delay in milk coming in due to delivery complications, illness, diabetes, eclampsia, preeclampsia, diabetes, postpartum hemorrhage, puerperal sepsis, puerperal psychosis, very late to detect, postpartum depression very late after 10 to 14 days only. But when it is setting in, this can delay poor attachment. Feeding at fixed times. You feel अभी 2 घंटे में पिलाया है, 2 hours is over after 2 hours only. My sister told me, my mom told me. So no, you can feed in between. Demand feeding is there. If you're feeding infrequently, if you're giving short feeds, you're in a hurry, you don't feed nighttime, you have lot of worry, stress, you're tired yourself, you're not confident as a primey, and there's no bonding with the child, due to many personal issues, family issues. You have no bond with the baby, and you don't like breastfeeding because you feel it will change my figure, it will disfigure me. I don't like to breastfeed. So if these are the things, definitely these are the challenges of low milk supply. And when you look at wholesome breast milk, there are, the types of breast milk. You have colostrum, you have transitional milk, you have mature milk, preterm milk, foam milk, hind milk. And when you look at the color of the milk, first 3 days so rich, so yellow in colostrum. Fifth day, you can see the color diluting. Sixth day and 25th day, it becomes more of milk in color. Colostrum for new babies, then foam milk, which is rich in water and nutrients to keep your baby healthy and hydrated. Plus, you also need hind milk, which is rich in fat, calories, which your baby needs to grow strong and healthy. So, if you look at the composition of colostrum, foam milk, and hind milk, the amount of protein is higher in the colostrum. So, always do not discard the colostrum. Always feed the colostrum to the baby. And human milk is far away more better than cow's milk, for the baby to digest. Cow's milk is difficult to digest. And let us see some common challenges quickly. You have mastitis, where the breast infection will cause pain, redness, and fever. It is very crucial to continue breastfeeding or pumping and seek medical advice for appropriate treatment. Some causes of blocked ducts and mastitis include short or infrequent breastfeeds, not removing the milk from part or of the whole breast properly. You have damaged breast tissue. You have bacteria entering the breast through a crack in the nipple. All these conditions can cause mastitis. Look at the abscess formation here. This diagram, look at the fluctuations over a superficial abscess, and look at very thin skin over the pus, and milk is coming out of the nipple. So, and when you look at breastfeeding in special situations, of course, it's very challenging. Can you imagine breastfeeding twins? Some of us, some of you, some of your relatives, patients, if they have had twins, you must have faced this difficulty because you need lot of support and preparation right from the antenatal period. A mother's body is capable of producing enough milk for both babies, as milk supply is again based on demands by the two babies. So positional techniques here, like you have a single football for a single baby, so you have double football here. So hold a double football hold or double cradle hold. You can look at the pictures, can help feed both babies together. You don't have to wait. It saves time, it stimulates more milk production, and while feeding together is more efficient. Individual feeding in the early days will allow for close monitoring of each baby's latch and intake. So initially try to feed individually, look at the latch, look at the intake, look at the swallowing reflex, sucking reflex, and then once you're confident both are good, you can simultaneously feed them. It's very important to stay well nourished for the mother, rest whenever possible, and seek support from partners, family, or lactation consultants, because with lot of patience, encouragement, positive encouragement, many mothers successfully breastfeed twins. And again, feeding the preterm babies becomes challenging because Breastfeeding the breastfeeding babies, preterm babies, is actually beneficial but can present unique challenges. Why? Because of their underdeveloped sucking reflex, swallowing reflex, low energy levels, and medical complications. Since this premature infants may not be able to latch effectively at first, the mothers are always encouraged to express breast milk early and give it in a palady and frequently establish and maintain milk supply. So they give it in the NICU, in palady or tube feedings or with syringe, drop by drop. When we were in FMC Pune students, we used to give every baby, we used to insert a orogastric tube, feed the baby and take it out. Those babies which could not be fed on the breast milk, the sick babies. So nowadays you have advanced this. We encourage palliative feeding or mother's breastfeeding, and we have breast milk banks now. That's another thing which is happening. Every hospital has beautiful breast milk banks where the mothers voluntarily go give milk, which can be used for preterm babies and other babies. And the breast milk provides essential nutrients and antibodies, which will protect the preterm babies from infections and support their growth and development. Again, skin to skin contact, kangaroo mother care, and feeding tubes or cups can support the transition to direct breastfeeding. So, slowly the preterm baby will learn to sip from the palady, then slowly try to learn to suck once it is able to. So, with again time, guidance, and patience, most preterm babies can eventually breastfeed successfully. So, there was another last point which I wanted to discuss. Like after cesarean section, what? Challenging, very challenging after cesarean section because there's a lot of pain, fatigue, delayed initiation of breast milk, normal delivery within half an hour. Cesarean, you wait for 45 minutes, 1 hour till the effect of anesthesia goes. But it is entirely possible and very beneficial for both mother and baby, helps in the involution of uterus, early skin to skin contact, and breastfeeding within the first hour, if the mother's condition will allow, can help establish good bonding and stimulate milk production in all women, all mothers who undergo cesarean section. And comfortable breastfeeding positions such as a football hold or sideline position can reduce pressure on the incision site. And of course, adequate pain management for the wound, cesarean wound, adequate hydration, support from family or healthcare providers will play a very, very important role in successful breastfeeding journey of the cesarean mother. And with patience and encouragement, most mothers can breastfeed effectively after a cesarean delivery. Now, I will not talk much about the lactation consultants because we have Ruth here from Cloud9, and I'm so glad that Nurselab has included two teachers and a lactation specialist in this webinar. And role of this lactation consultants, because they are professional support and they will help the mothers through education and care. They'll teach them early skin to skin contact, initiating breastfeeding both in vaginal and cesarean deliveries. They will help and support mothers to recognize hunger cues and breastfeed successfully on demand. Of course, they will address common problems in breastfeeding during their hospital stay and will ensure 24/7 rooming in of mother and infant diets, no cradles, no cots. Together, the mother and infant counsel the mothers both in the antenatal clinic and postnatal wards, like in antenatal period, pulling on the nipples if you have flat, inverted, retracted nipple, teaching them to pull it on and with coconut oil, make it during the bath so that you prepare the nipple for the breastfeeding. And the risk of artificial teethers, pacifiers, bottle feeding, formula feeding, she will tell. We used to throw, when I was posted in Air Force Hospital, Kanpur, if I would see, there used to be 40, 50 postnatal mothers. If I would see any bottle with milk, I would just throw it out and I would encourage her to breastfeed. And coordinate discharge planning by ensuring effective breastfeeding and counsel mothers on post discharge follow up. All this, the lactation clinic and pediatric OPD, Ruth ma'am will be talking about it. I just want to tell in this slide one thing, that one of my students in INC consortium is doing a very nice PhD study on nurse-led lactation clinics in army hospitals, going to get over. So it's a very important that you have lactation consultants and even a small Continuing nursing education program or elective modules can be initiated in nursing colleges so that the students who are all the time in the postnatal wards can do a good job with initiating breastfeeding and providing lactation support. In the end, I would like to say that breastfeeding is a journey that comes, with its unique set of challenges and rewards. And by understanding proper latching technique, being prepared to address common issues, and appreciating the numerous benefits, the mothers can definitely navigate this important phase with confidence and support. So we all know breastfeeding is a mother's gift to herself, her baby, and the earth. Thank you so much for giving me this opportunity.
Thank you, ma'am, for that detailed explanation and session. We'll move on to the next speaker, Mrs. Ruth Patterson. Mrs. Ruth Patterson is a lactation consultant and specialist currently working at Cloud9 Hospitals, Bangalore. Ma'am has a total of 35 years of experience and 20 years being in lactation. She has completed her BSc and IBCLC and has later worked at prestigious institutions like St. Philomena's Hospital, St. John's Hospital, Saudi Arabia, and is currently practicing as a lactation consultant at Cloud9 Hospitals, Bangalore. Mrs. Ruth aims to train all nurses to support mother and baby for breastfeeding. Ma'am has also done her research in non surgical methods to drain abscesses and has obtained a patent on this method. We are so privileged to have ma'am on this platform with us this evening. Welcome, ma'am. Over to you.
Yeah. Thank you, Tanya. It's wonderful to see. And thank you, Nurseslab, who's no, given me opportunity to present and especially occasion of Breastfeeding Week. And thank you, Dr. Sudha. You have covered wonderful topic, which mostly you completed my topic. And it was an awesome explanation. I really admired. First time I'm listening because always I'm taking a session. So it was very nice and very nicely covered all the topics which women go through from day one to prematurity to and continuity support. So you all of you know this year breastfeeding week theme is prioritize breastfeeding, create sustainable support system. So how do we do it with all aspects which we go through? So the special thing is my motivation is mother to mother support groups, community healthcare workers, and play a crucial complementary role in promoting, protecting, and supporting breastfeeding at the community level. So we all work out on the urban areas in the hospital and we support, initiate, breastfeed, and they go home very early. By second day or a third day when the milk production starts, they leave the hospital premises. After going home, what happens? Women go through a lot of challenges where some of them struggles with the latch, techniques, and painful feeding, and then engagement that is not dealt properly. It leads into mastitis and breast abscess. The breastfeeding actually goes haywire, and mother feels insecure and feel guilt that she is not able to breastfeed. Yeah, so how are we going to protect and promote and support in the community level? So, peer support and empathy. Peer support network is very, very important as for me. It is not the journey starts from the hospital, and we need a continuity support. So, peer support is very, very important to give empathy. Mother who goes home, she feels she takes a help from the elderly parents and mother, grandmother. Sometimes it is not so easy how we talk about hold the baby like this, attach the baby, deep latch, shallow latch. It is not possible with the various reasons. 30 to 40 percentage of women is struggling with the various problems in attachment. So, how this peer support helps in supporting? It is, they'll offer emotional and social support from mothers with shared experiences. And it helps reduce feelings of isolation or anxiety, especially for a new or struggling mothers. That is when we find it if the mother is nuclear family and no help system is available. Nowadays, we find it like this, be it in an urban area, be it in a rural area, though you have a help in rural area, though you have a help in urban area or not, no help in urban area, there are so much of struggle women go through of postpartum depression, postpartum blue. This is common, but then how do you deal it? When they cannot keep coming to hospital after getting discharged, everybody tells this breastfeeding is easy and breastfeeding is a natural and it's a natural art. But then what happens? Natural art is a learned art. So though they are staying in the hospital stay short time, whatever we teach, and it is not sufficient for them to sustainable support system to continue breastfeed. So that is why peer support system is very, very important, and sharing practical advice beautifully. So many mothers they come encouraging breastfeeding norms. This is everybody should be aware in the world, in the human. It is not just the hospital workers or healthcare workers. Every human being should be aware of normalized breastfeeding in the community. If they are aware, then it can become normalized. Promote exclusive breastfeeding for the 6 months and continued breastfeeding up to 2 years or more. And then people will say, 2 years, it is very difficult to stop. My baby will not be able to stop. My mother is telling me to stop. My grandparents are telling me to stop. No, anthropometric age for the girl child is 3.5 years. And for the boy child is 7 years. Olden days they were feeding. That is why they were able to emotionally, physically, hormonal balance, everything was set. Yeah. So at least whoever comes into our hand, we should never discourage them not to feed more than a year. More than a year, most of the healthcare workers also they say there is nothing comes from the breast milk. Only water comes, no benefit. Stop. Please, if you are listen to this session, make sure every woman has to be permitted to feed 2 years at least. If they are continuing, encourage them to continue. And referral to health professionals. Encourage mothers to seek help from trained professionals. So, as I said, peer support. If they feel that whatever is worked for them, sometimes it works for the community also. Sometimes it doesn't work. So, they should not stop there. They should be able to link their no health professionals, especially lactations, IBCLCs, International Board Certified Lactation Consultants, are able to support much, much better because you have been assisted at the hospital, positioning attachment, and then the baby is coming back with the no not gaining weight, getting into hyperbilirubinemia, and everybody blames the mother, doesn't know how to feed, and then people will support you feed like this, deep latch, and then mother keeps trying, it doesn't happen. And then there are so many support systems they try to help, doesn't happen. Every woman should take a professional's help. There is a lactation consultant available in the community. They should be able to take a help from the IBCLCs, and the doctors also will be able to guide them to guide in a right path to the lactation counselors. So community mobilization, if this is all very, very important, we have to organize awareness campaign during events like World Breastfeeding Week. What we are doing, Nurseslab. It is not that mother given a birth. It is her duty to hold the baby and attach. Yes, of course, if everything falls in place, it happens. Sometimes with the pain, it is very difficult for a mother to latch on to entire areola, how we speak about deep latch. Did anybody think about baby oral cavity? There are oral cavity restrictions are there. Oral cavity mild anomalies are there, which is already, no, Dr. Sudha was talking about tongue tie and then vasospasm on mother's side. And then what about baby side? Anybody is looking at baby's oral restriction? Because oral restrictions are not visibly seen until and otherwise you assess the breastfeed. Why the deep latch is not happening? Why the baby is slipping and coming to nipple? What is the reason? If you find out that the mother is not felt guilty, Otherwise, we always tend to say, hold the breast, push the breast, the entire areola. Doesn't work at all. Sometimes 30 to 40 percentage of in my patients who comes in, they struggle 1 week, 2 weeks, go around. Later they come back feeling guilty already. I don't want to breastfeed. I've gone through a lot of problems. Everybody is blaming me. Already mother is in depression. So many things. When we look into it, very simple issue, restriction on the baby. That could have been corrected by small exercise, could have been referred to pediatric physio or craniosacral therapist. For that, you need to address the issue. That is why, if anybody not able to assist the mother or achieve the breastfeed, they should be able to refer to the IBCLCs or the lactation specialist. And what is the role of community health workers in breastfeeding? They play a very important role. They are the one trained frontline workers who provide essential health services and education at the household or village level. So village level, in a urban area, they seek help sometimes. That also is not addressed. But rural, they are not able to reach the help. So community health workers are very, very important. What is their role? They have to be breastfeeding education. Teach mothers especially early initiation of breastfeed, exclusive breastfeeding, and continued breastfeeding. So early initiation, it starts from the hospital, wherever they deliver, PHC, government sector or private sector or corporate sector, whatever sector they deliver, early initiation, everybody should be able to initiate. Initiate first from us, from the healthcare worker. It should be done on the table. As Dr. Sudha said, normal delivery, it will happen half an hour. Cesarean might take 45 minutes to 1 hour. Yeah, but I would recommend the soon after baby is delivered. Most of the gynecologists, they place the baby on the abdomen. They give a cord, a timing for a clamping for a 1 minute, and then delayed cord clamping. They cut the cord, and then the moment the pediatrician assesses the baby, the abgar is fine. The baby should be brought to the breast as early as possible. This helps in prevention of many things, and early initiation will help in exclusive breastfeeding, and it helps the mother to continue to breastfeed. And there are a lot of myths and misconceptions. And in rural, if you take, urban is much, much better. In the rural areas, they start giving water, sugar water, honey, and then they feeds the 3 days milk colostrum is not safe, it is infected, and the formula is the best for a 3 days. So all those things has to be addressed, and community health workers, it is very, very important they educated on this, and then it is informed during pregnancy, so that the mothers are aware of it. And early identification of issues. Recognize and breastfeeding problems. Poor latch, low weight gain, engagement. Again, the problem comes back and again and again. We look into it, areola attachment, 3/4 of the areola has to get in. And then mother also focus on it, but then doesn't happen. Because of the poor latch, the baby will not gain adequate. And because baby is not draining the breast, it leads to engagement. The engagement is not dealt on time. It leads into pathological engagement and mastitis, blocked duct and abscess, and then surgical intervention. By then, the mother is struggling to breastfeed. Sometimes they may stop breastfeeding if the IND happens. And so these type of issues, if any community health worker, if noticed, they should be able to provide initial management and then refer them to the respective specialist, so that these mothers are protected and not to get into major issues where they have to stop the breastfeeding. And home visits and follow-up is very important. Conduct regular home visits to check on infant feeding and maternal well-being. Provide consistent support during the postpartum period. And that's the reason NGOs and government sector, they believe on periodical training, and they appoint Anganwadi workers to go to the regular home care service visits, so that the mothers are maternal well-being as well as the babies on breastfeed. And linking health system and communities. Act as a bridge between health services and families. It's very important. And most of the time, mothers, when they come back to me after a month, I ask them, do you know that there is a specialist for the lactation? Why did you suffer so much? They say, my parents have told it is a breastfeeding, painful. It will be painful. Babies will cry, and you have to keep feeding, and bleeding is normal, and you have given a birth, you have to take care of all those things. This is ridiculous. And it cannot be, breastfeeding cannot be painful. If there is pain, that means there is a problem with the latch. Why the latch is not happening? As per the theory and how Dr. Sudha had shown in the PPTs, wide open mouth, lower lips turned outwards, complete, entire areola of below areola than above, asymmetrical latch, nothing is working out. That means they have to link the parent, mother to the health services. So usually they should be able to know first lactation consultants are available, and then they should refer to nutritionist or healthcare facilities if there is a real requirement. And support in emergencies or special situations, that also explained by Dr. Sudha. And natural disasters, malnutrition, all those things has to be looked into it. And support feeding of low birth weight or sick infants, these they have to take a special care and help the mother. Together, they create a socio-cultural environment that supports breastfeeding. Help achieve global breastfeeding targets. Empower women through education and support network. So many things we have to do to achieve this socio-cultural environment which is going to support breastfeeding, and global breastfeeding targets. WHO, UNICEF, global nutrition targets we can achieve, empower women through education and set network. Okay, now digital tools for breastfeeding. We are looking at sustainable support system for the breastfeeding. Mobile apps, now urban. Most of the patients now, when I'm seeing, they'll say, I've seen ChatGPT. Earlier they'll say Google. Now they're telling ChatGPT. ChatGPT says this, so I did this, didn't work out. So the ChatGPT said, if doesn't work out, please reach the lactation consultant. I really admire whatever it is. So the mobile apps for breastfeeding, their features are breastfeeding tracking. Some others, they come with the app. When I ask how often baby feeds, baby demands, or how do you feed, what is the duration, immediately they'll show the app. It is so wonderful. Earlier, we used to write down on the notebook. Mothers have time, they write down. Sometimes they don't do it. It's so making life easy. We should utilize these digital tools. So feeding times, duration, and which site she has used previously. So she will not have any struggle in that checking. And growth monitoring, weight, height, get circumference charts. Wow. Educational contents. It's given videos, plenty of videos are there, articles are there, FAQs are there. Whatever they want, they put their questions and they get the answer done. And the reminders. If mother sleeps off, next feed, pumping session, doctor visit. And lactation consultant access in some apps are there. And breastfeeding solutions app, evidence-based help for common problems. And early identification of issues. All those things, when we can get it from in our hand, make use of it. If doesn't work out, please reach out to the lactation consultant. And telehealth for lactation support benefits. So when real-time expert advice from IBCLCs, nurses, or pediatrician. Yeah, I'm also a nurse, and I worked in the baby-friendly hospitals. How the situation happens from young mother to aged mother breastfeeding and prematurity and unable to breastfeed. So many cases I have seen. I have seen how women are struggling. So I felt this is not sufficient. It is not just the positioning attachment. I felt I have to learn beyond that. That is when that was motivated me to do the IBCLCs. So I have understood this is not just the latch, it's the beyond the latch. So I'm able to help the mother and I'm able to help the baby. So they were able to achieve, and the mother is, if even they are not able to achieve, they are able to at least not feeling guilt when they are not able to feed. And accessibility, ideal for rural, remote, or pandemic affected areas. So all of you know, during COVID time, That's video consultations are bloomed. Now, till today, I do the video consultations, and still people will say it is very difficult to deal on the video consultation. But 90 percentage of the issues are sorted out through video consultations so that they are not struggled. And even visual assessment, latch, positioning, feeding cues beautifully I've seen Dr. Sudha's slides. It's early cue, mid cue, late cue. So never allow baby to cry for a feed. If the baby start crying, baby will turn into pink and then they get very aggressive. If you try to position, it doesn't happen. So you have to ask sorry, calm the baby. And then once the baby calms down, then you'll be able to take the baby to breast. So better early cues is better. And follow postnatal support and progress tracking. So I would know all my whomever I come across, I do tell many hospital setup. When the baby is being discharged, mother and baby has been called fifth day, and mother has been called to see the gynecologist by seventh or eighth day. Why not if they can see the lactation consultant on a fifth day? So that most of the problems are addressed, because the third day milk start coming in, third to fifth day, 5 days, the 2 days time, the mother go through latch issue, engagement issue. That could have been addressed if they come and meet the lactation consultant on fifth day and seventh day when they come to visit the doctor. And these digital tools are used by hospitals, private lactation practices, government health system, and apps like Amma, Pacify, or Lactap within app teleconsults. This is all new to me at times, but then I've seen how people are using the digital tools. And online forums and support communities. So social media groups. Now what Nurseslab is conducting. Like that last week I did Facebook and Instagram groups. And so discussion forums like baby center. What to expect? Dedicated platforms. La League, online communities. Wow, they all are super. You will get a lot of information from them. Advantages 24/7 support and interaction, cultural and language diversity in groups, reduced stigma for discussing concerns. Because sometimes mothers who comes to me, I have a low supply, I don't want to feed, I don't have nipple, I have inverted nipple, I have a heavy breast, I know I'm going through pain, I cannot breastfeed, the family is forcing me to feed, I'm going through pain. So many problems. It could be online forums could be supported without stigma. And always I tell my patients, not all advice is evidence based. Moderation and expert input are important to prevent misinformation. So everything there is a limit, and everybody should be aware there is an expert. If there is a problem breastfeeding, they should be able to reach out to the lactation consultant. If baby is very sick, not able to take, they should be able to address to the pediatrician. And mother is struggling with the problems, she should be able to meet the gynecologist. All this information should be given, though they take it from all digital tools. Benefits of digital tools: increased access to timely quality support. You don't need to waste your time. Convenient for working mothers or those with mobility issues. Personalized learning at mother's pace and comfort. Most of the mothers, when they lie down, they open the tools. And continuity of care from pregnancy through postpartum. It's an awesome support. We get it through digital tools. And set clear public health goals. Increase exclusive breastfeeding rates to 6 months. Most of them 1.5, 2 months time, some or other way they get into low supply, they feel, and they start the formula. So we have to keep having the goals to encourage exclusive breastfeeding rates to 6 months, promote early initiation of breastfeeding within the first hour of birth, reduce formula marketing influences in the community. These goals should align with national health policy and global frameworks like WHO, UNICEF's Global Strategy for Infant and Young Child Feeding. Second, roles of NGOs in the collaboration. NGOs are vital in grassroots mobilization, education, and advocacy. So, key contributions are community outreach and awareness through rallies, workshops, street plays, and training peer counselors and community health workers on breastfeeding support, creating IEC materials, pamphlets, posters, social media content. That's the information, education, communication materials. We can make it, or WHO has so many people which I have discussed, NGOs, they create a information and education communication materials. We can make use of that. Policy advocacy for breastfeeding friendly environments, workplace support, maternity leave, and these things will actually support the mothers to continue breastfeeding. And NGOs are La Leach League, Breastfeeding Promotion Network of India (BPNI), Save the Children, UNICEF supported NGOs. So that comes to training for healthcare providers, and this is very, very important. We have spoken so much from Dr. Sudha's presentation and my presentation. It is a building capacity through structured, ongoing, and supportive training is essential to creating a health system where breastfeeding is protected, promoted, and supported at every level. That's what I do it in Cloud9 Hospital. Every nurse who joins at the hospital, within 3 months, they should be able to attend 18 hours workshop, so that the basic understanding and bedside supports, they have been able to render the support throughout their hospital stay of the mothers. Thank you so much once again, given me this opportunity.
Madhushila ma'am is the Principal of Narayana Hridyalaya College of Nursing, Bangalore. With over 17 years of experience in nursing education, ma'am has specialized in OBG nursing and has a lot of experience in teaching at various levels, organizing workshops, guiding research projects, and enhancing student learning outcomes and enhancing professional development. Ma'am has completed her BSc Nursing from Apollo College of Nursing, Chennai, and her MSc Nursing from the KG College of Nursing, Coimbatore, and is currently pursuing her PhD from Annamalai University, Chidambaram. Ma'am has attended various international and national level workshops and is a recognized PG guide under the RGUHS programs in Karnataka, Bangalore.
Thank you for the opportunity. And here we had two experts. Very nicely, they have presented about the breastfeeding importance, positions, and we have a lactation specialist who told, especially part of my presentation is about the support from lactation and the counseling. So here I would like to start on with the presentations about social and policy dimensions in breastfeeding. So as everybody discussed, here I'm just briefing out the importance of breastfeeding. So breastfeeding is a process of feeding an infant breast milk, either directly from the breast or expressed milk fed from a bottle. Here we are considering the breastfeeding which is given within first hour of birth, considered to be the first vaccine, which is told by UNICEF. And considering the importance of breastfeeding, the UNICEF and WHO has recommended to initiate the breastfeeding within first hour of birth. And the second one is exclusive breastfeeding for the first 6 months of baby's life. And it is followed by continuing the breastfeeding even though we are starting the weaning. It has been advised to continue the breastfeeding for up to 2 years or beyond. Breastfeeding is a way of providing ideal food for the healthy growth and development of infants, and thus ensuring its survival. And we also consider breastfeeding is safe, clean, and it contains a lot of antibodies, which help protect against many common childhood illnesses. If we look into the statistics, only 2 out of 3 children are being not breastfed in the first 6 months. So we are more focusing on, so nearly around 2 out of 3 infants are not exclusively breastfed for the recommended 6 months. So here WHO is trying to promote the breastfeeding since it is found to be a best source of nourishment for the infants and young children. And they are trying to increase the rate of exclusive breastfeeding for the first 6 months. So if we look into the statistics, it was only about 44% of the infants were breastfed. And according to the statistics in 2023, only 48% were breastfed. But the target was fixed as 50% by 2025. And they are targeting to increase it to 70% by 2030. Here we had certain factors why the breastfeeding is not happening, why we are unable to reach the target. We had few factors influencing it. One is the caregiver and society believes in mixed feeding. So they think that breast milk is not only alone enough for them. So they are trying to add the weaning foods. Hospital and healthcare practices are not supportive for breastfeeding. So as the previous experts were saying, we need to have the supportive systems to help them in improving the feeding things. And lack of skilled assistance, lack of support, and they are trying to aggressively promote the infant formula is also being one of the factors which reduces the exclusive breastfeeding percentage. And inadequate maternity and paternity leave legislations and other workplace policies that support a woman's ability to breastfeed when she returns to work. Since we are lacking in this, we don't have facility and we do not have enough time to feed the baby. So we are joining the work early so that the 6 months of exclusive breastfeeding is also being affected. And as the previous experts were saying, most of us do not know the dangers of not exclusively breastfeeding the infant. So these are all different reasons or factors which is not allowing us to get into the target and reducing the percentage level of exclusive breastfeedings. So considering that the WHO and UNICEF has given this global breastfeeding collective, so they are concentrating on increasing the funding, enforcing strong legal measures, and enact paid family leave and workplace breastfeeding policies, and implementing the 10 steps to successful breastfeeding, improve access to skilled breastfeeding counselings, and they also trying to link the healthcare facilities by strengthening it. So here mainly they focus different points to improve the rate of breastfeeding. So when you look into the targets, like these are all the scorecard which is provided in 2023 showed they have kept a target at 2025, and now the target in 2023 is to reach 70%. And slowly we are increasing comparatively with 2023. 2024 had slight improvement. Hope this we will be able to reach the target by 2030. Looking on to this workplace support and legislation, considering combining the work and the breastfeeding is not only possible but also essential for both mother and child. So here we are focusing on baby friendly workplace. So baby breastfeeding friendly is providing the woman with comfortable, and they also need to provide some facilities to express their breast milk and to store it and then to provide it, so that we are able to promote the breastfeeding even after 6 months. Beyond 2 years was one of the criteria we will be able to achieve. The rights and obligations here, as a minimum, employers need to compile with any existing legislation on maternity leave and workplace breastfeeding support. So here actually the UNICEF is recommending at least 18 weeks of maternity leave, striving for at least 6 months of paid maternity, paternity, and paternal leave after the birth, so that they are able to promote the breastfeeding by providing the support. So we can expect the exclusive breastfeeding up to 6 months. Here we have certain authorities also helps and supports legally, that is ILO Maternity Protection Convention 2000 Article 9. As per that, they are trying or they are saying or insisting on providing breastfeeding room for the mothers in workplace or a private space for them. So support the breastfeeding mothers at work by providing regular breastfeeding breaks and establishing a private space for the breastfeeding. So even though we are giving them breaks, it should be a paid breaks. We are not supposed to cut down their salaries or things. So with the paid breaks, they should be provided opportunity to feed the babies. And second point, what they are insisting is the employer should arrange training for managers on the benefits of breastfeeding. So as the previous speaker was talking about the importance of training the healthcare professionals. Similarly, we also should, the employers also should arrange training so that they understand the importance, so that they provide the opportunities for the exclusive breastfeeding even in workplace. And providing the room or space to breastfeed. So this is also being insisted that they need to provide a safety environment for the mothers to breastfeed. That is, providing a room or a space to breastfeed allows a woman to combine work with motherhood, helps employees to return to work after maternity leave, and shows that the staffs are recognized. So even here, the staff is also happy and the organization is also benefited. So they focus on providing them the safe environment. So here comes the breastfeeding room at workplace. So the insistence is given on providing a workplace for breastfeeding. It is an exclusive and properly equipped area for mothers to breastfeed their children, express milk, and store it. So this area has lot of they need to provide facilities for them to sit in a calm environment, breastfeed, or they have to be given with the facilities to express the breast milk and then store it in the fridge. Okay, so for that, and hand washing, for that also the area should be provided. So generally, when we talk about the breastfeeding rooms, should provide the following, that is, they should have adequate space and the privacy should be maintained, especially, and should have adequate lighting. Ventilation should be good enough. Hygiene, especially for hand washing and all, we have to provide them facilities. Accessibility, it should be near to the area where we work. The working area and the feeding room should be accessible, and they should have adequate furnitures for the mother to sit and to arrange the articles. If suppose mother need to express the breast milk, so we need to have adequate furnitures and the supplies also. So we need to provide all these in the breastfeeding room. Then employers actually have a responsibility to ensure safety for women in the workplace, free from environmental hazards. They should also prohibit discrimination in the workplace on the basis of pregnancy, breastfeeding, or family status. And a breastfeeding room should be located in a physically separate area with direct access away from restrooms but close to the workplace. So make sure that it is being near to the workspace but out of the restroom and those infected areas, because there may be chance of infections happening to the coming to the newborn. And it must also ensure privacy, so entrances must therefore be closed properly and the facilities must be designed to ensure the mothers using the room are not visible from outside. So it is a part of privacy also. It is suggested that the space should be fully available during the workday, and that clear sign board need to be placed inside and outside the room so that the mother will feel confident and she has the privacy. So without any hesitance, the mother will be able to continue the breastfeeding. And it is necessary to take into account the location of the space to maintain a distance from the areas where toxic substances are handled. So that also is another concern when the feeding room is being placed. All these concerns need to be taken care and the organization need to arrange. The lactation room should have exclusive access control for breastfeeding women and cleaning staff so that we make less number of people entering and coming out. So we maintain the hygiene of the particular area. Now coming on to the benefits. So why should the organization provide and what is the purpose of that? So the organization also gets the benefit and the person, the mother also gets the benefit. So here by providing the breastfeeding room in the workplace, how are the benefits? So improving the corporate image of business, showing that they care about the health and well-being of working women and their families. Reducing the amount of leave requests made to attend the doctor's appointment for the mother and child, since the mother and child are allowed to be here, so that they cut down the leaves. Reducing maternity related absenteeism. So because we are trying to keep them together, so we try a lot of morbidities so that the number of leaves and absenteeisms are being cut out. And because of these benefits, the employee turnover rates also will come down, since the organization is also benefited and the mother and child is also being benefited. So what are the benefits of mother and child? It facilitates a greater balance between breastfeeding and work, helps breastfeeding women feel more at ease during working hours, and it increases breastfeeding women's sense of belonging and commitment to the company. Since my company provides me, so I will be more committed. So it avoids lot of absentees and the leaves. Increases working women's performance. Now, as the woman gets all the benefits from the organization, the women also feel to provide more outcome to the organization, so she'll be more motivated. And it also helps employees to return to work after maternity leave. Otherwise, what happens usually when we get maternity leave of 6 months, but still we want to feed the baby, since baby is not taking other feeds, we try to extend our leave, or we may quit the job. After a time we will join. So to avoid that, it also provides an opportunity, because we have the breastfeeding room and we have facilities. They also provide the place for us. So the number of people will not quit the jobs. They will also return to the work immediately after the maternity leaves. And it also allows the woman to combine work with motherhood. So that is the important thing of providing the breastfeeding rooms in workplace. It also shows that staff are recognized, respected, and supported as mothers and fathers. So that is how we, the mother and the baby, is also benefited, and the organization is also benefited by implementing, providing the breastfeeding rooms in the workplace. Now moving on to the feeding practices and beliefs. Like few of these points, Ruth ma'am also has spoken about it. We have a lot of cultural practices and a lot of taboos and beliefs we need to come out of that. Okay, so what are those cultural practices or feeding practices affects the breastfeeding, exclusive breastfeeding? So one among that is a belief in need for pre-lacteal feeds. In previous session, ma'am was talking about they don't give colostrum. They instead of colostrum, they go for pre-lacteal feeds, thinking that that will establish the breastfeeding in a good manner, and they avoid colostrums, and they will have concerns about neediness, and they feel that human milk is insufficient. Generally, like mother will undergo with lot of stress, saying that the child is keep crying and your milk is not sufficient, so you need to give artificial feeds. So many of us would have undergone these feeding practice difficulties. And there is also belief that they need early food supplementations. So they think that the milk is not adequate. So let us start some food along with that. Okay. So they go mixing up with formula feeds or cow's milk and such things. And need for strong parental control over the act of feeding. If not, they go for stopping of breastfeeding, and then they will be thinking about different aspects. So we have a lot of cultural feeding practices and beliefs which is affecting the breastfeeding. And there is something beliefs about colostrum in some part of the countries, like they don't consider, or they don't give important, even though that first breastfeeding is considered to be the first vaccine. Many people is not ready to give the colostrum. They think that is not good for the child and they discard it. So they, instead of that, they try to feed them with some pre-lacteal feeds. So that need to be observed, and that becomes one of the cultural beliefs or something. And even that throwing of colostrum is also varying between the birth order and whether it is a male child or a female child. Accordingly, also this practice is also changing. And there are certain traditions and taboos which we need to understand is breastfeeding mothers often observe specific traditions, taboos, some based on cultural beliefs. What are those? So after birth, mother is actually protected. Few may be good, few are not okay for us. Actually, after the like when the mother is pregnant from 7 months, they usually send that mother to her mother's house, because they think at mother's house she will get adequate rest and she will be fed well and she will be having good healthy diet rather than working alone in the her own place. So that becomes an advantage also. So after the birth, mother is protected from the housework and exclusively looks after the newborn infant. So she will be getting time and good things to take care of her baby. And traditionally, she is cared by female relatives. So we have different cultures. They have some separate people. They will be providing separately kept for their purpose, and they will take care of them. They will provide whatever food, and they will be taking care of the baby and the mother. So we have a group, a person fixed for that purpose only. So that also certain cultures follows. Even though we have lot of advantages in taking care separately, they also force some dietary restrictions on the postnatal mothers. So here they keep a lot of restrictions, especially on the dietary foods. And even in the hospitals, when we go for rounds, postnatal mothers will have only 1 liter of water. The mother will say you have to have only 1 liter of water per day and not more than that. So that causes a lot of restrictions. But actually, there are no restrictions like that. But since as a tradition, as a belief, they keep restrictions on the diet. So something like that, hot and cold foods. We have a belief that certain foods is cold, certain foods cause hot, which is not healthy for the mother, not healthy for the baby. They may get cold, they may get fever. The child may not have proper digestion. There will be indigestion problems. So believing that, they keep lot of restrictions on the items. Similarly, specific food avoidance. They won't give all the food items or all the things for the postnatal mothers. They restrict lot of things. Sometimes they give only plain rice or rasam rice or ganji, so some bread. So they have a lot of restrictions and they avoid all the healthy foods. But whenever we go, we are giving health educations and having healthy diet. They will just give a blank gaze on us. Okay, that is because we have a belief or traditions and some particular group of people of avoiding some food and avoiding some specific things. Here in another example is avoid eating some spicy foods. No, they think that when they eat some spicy foods, that is not good, that will cause some indigestion and things. So few things is acceptable, but they force lot of dietary restrictions on the mothers. Similarly, there are other restrictions also which they place on the mother is limited physical activity. In some cultures, mothers are encouraged to rest and avoid strenuous activities during postpartum period. That is one side good, but still they should be allowed to do some physical activities at home and restricted social interactions. Many of us also would have undergone this. We are not allowed to go out, not we won't be able to go and enjoy any programs or any functions, or we are not allowed to go for shopping. So we will be just got arrested in the house. So that will actually cause some emotional disturbances. Psychologically, they will be upset. So that kind of restrictions also will be faced as a part of the cultural belief and taboos. And seeking advice from traditional healers, they won't take the advice what we provide. So ma'am was talking previously in both the sessions, they were talking about the counseling, taking part of the community members in, and we need to teach them the importance. But there are people who will not accept the informations what we provide, and whatever they traditionally follow only they'll be focusing on. So these kind of beliefs and taboos actually affect the breastfeeding practices. And certain areas in rural area, when we observe, one of the reason for breastfeeding is not for the healthy reasons. They think that when they breastfeed the baby for a longer duration, they think it can postpone the next pregnancy. So considering that, they are breastfeeding. Anyway, that is one side good, but that is also a kind of belief some kind of rural people are having, and then it is being followed in certain areas as a belief. Now, what are the problems? So what they may ask, if we are following our cultural things, what is the issue? So that cultural beliefs certain times have some potential impacts. So what are the impacts? One will cause nutritional deficiencies because they restrict lot of food items. They even restrict the amount of water. So that actually causes the deficiencies in the mother as well as in the newborn. The other one is emotional distress. Since they are into the house, into the home, they do not have adequate social interactions. They will never allow them to have interaction with many people. They are not allowed to come out. So these all things will cause emotional distress in the mother. That is one of the reasons where the mother goes for psychological problems, okay, depression and the blues and such things. And other impact is misinformation and lack of awareness. Some traditional beliefs about breastfeedings are not supported by scientific evidence. So they just believe what they follow only. They won't allow, because of that, the child and the mother will be affected. And here we have a role to overcome. So there are modern perspectives to overcome the taboos. Here comes the role of the lactational counselors, the support groups. So here Madam Ruth was talking about taking the part of community in, bringing them in. So that is very important here. Without that, we won't be able to come out of these taboos. So here, with the help of organizing some workshops, seminars, or going to them, giving some individual educations about importance of balanced diet, emphasize them why there is no restriction, you need to give. So, okay, we are trying to explain them about it. Balanced and varied diet for breastfeeding mothers to ensure the adequate nutrients so that we can avoid the deficiencies happening to the mother and the baby. And next one is evidence-based advice. So ma'am was talking about evidence-based advice. Even though we get lot of advices from app, but all that advices are not evidence-based. So we need to consider evidence-based advice which an expert only able to provide. So while respecting cultural traditions, healthcare providers encourages mother to seek evidence-based information. So we cannot totally tell them, okay, no, go, don't follow your taboos or beliefs, but still we need to explain them what is the impact of that and how can we overcome, so that they will be able to accept our advices. Then open communication and support. Here in different cultures, they won't be able to explain. Even ma'am was talking about in the previous session, the mother will say to her daughter, yes, the breastfeeding will be painful, blood will come, breast will engage. So all such things where they don't want to communicate it with others, and they make the problems complicate. So here we need to encourage them for open communication and support system, where we give, now as ma'am said, there are a lot of Facebook and lot of social medias which can help them to express their doubts, and then we can clarify them. So that will really help them to overcome these taboos and the impact of the taboo. So open communication and support is one modern perspective where we can overcome these problems. Now, other concern over here is about public breastfeeding and stigma. Public breastfeeding and stigma is, however, we become modernized and things, it is still over there. Public embarrassment and disapproval. Many mothers report feeling uncomfortable breastfeeding in public due to disapproving stares, judgmental glance, or even being asked to leave the public spaces. There are few countries where they don't allow public breastfeeding, and they ask them to leave from there, and they need to go to some unhygienic areas, and they may have to breastfeed. So such kind of things are also happening. Even in US, 43% of US adults believe that women should have right to breastfeed in public place. In India, we have only around 6% people will have strong means guts. I mean, they believe that they can breastfeed in public place. Actually, it is allowed, but due to some of the disapproving stares or judgmental glances, many would try to avoid breastfeeding in the public places. That is becoming a stigma. And other common stigma here is misinformations. Many of them will say that breastfeeding more than breast milk, infant formulas are very helpful. They provide lot of nutrients comparative to breast milk. So these kind of misinformations also will make the mothers to stop or avoid breastfeeding, and then they go for formula feeds. And lack of support, yes, if we don't get adequate support, and then the level of confidence will go down, and then we won't be able to continue the breastfeeding. So support from family, friend, and healthcare provides is often lacking or conflicted, further contributing to the stigma. So they slowly avoid breastfeeding and they jump onto the formula feeds. And societal attitudes, like many believe breastfeeding is a private act with so that they don't want to breastfeed the baby in the public place. Cultural norms, some cultures, some countries do not accept it, and they try to say them not to leave the place, and then they don't support the breastfeeding in the public places, also becomes a concern over here. And lack of public facilities, when we go out to the public areas, maybe for the shopping mall or for the hospitals, and we do not have a dedicated, or in the bus stops, railway stations, when we don't have a dedicated place for the breastfeeding, that becomes very embarrassment for the mothers to feed. Okay, so lack of public facilities also one concern. And workplace challenges, so many workplaces do not provide designated lactation rooms or nursing breaks. That is why people quit the job or they take a lot of leaves, and then they will extend their joining dates, and all that happens. Workplace challenges. And silencing realities, this is mainly the women have lot of struggles, but still they don't want to openly discuss it, and makes the breastfeeding affected. So that is also another concern over here. How to overcome this breastfeeding stigma? We say this is stigma, but we have a major role in overcoming this stigma. That is, we need to break the chain of stigma. Addressing this challenge requires a collective effort to educate society. This is only possible with the help of the lactation and the supportive groups of lactation counselors. So we are able to break the chain. And how do we break the chain? By empowering the education awareness. We need to give adequate awareness. And so we are taking a chance of this breastfeeding awareness week. Okay, so breastfeeding week we conduct even from our college, hospital side. We go give awareness, tell the importance of breastfeeding and the different positions, what are the advantages, disadvantages, such things. So this empowering education and awareness actually helps even providing avoiding the stigma of breastfeeding in public place. And mothers, inform the mother that say that it is her legal right. It is not that she need to vacate the place, or she need to give formula feed when she goes to a public area. So that is also another thing. Information need to be provided to the mother that it is legally accepted. And inclusive spaces, business and institutions can support breastfeeding mothers by providing the designated areas. That is what I was discussing in the previous thing, that is breastfeeding area in the workplace. Mainly that also helps to overcome the stigma. Support system, we should have adequate people to support, help us, so that mother will have a positive experience. So even Madam Ruth was talking about it, and Madam Sudha was talking about it. So they all were talking about positive experience in the mother. When the mother will have positive experience, when she's relaxed only, she'll be having a positive experience, which can also help us to overcome the stigma and come out. Usually, ultimately, when we see here, no parent should ever feel ashamed of how they feed their child. Ignoring everything, the mother should think that she is feeding a baby a healthy food, so that she need not to think about or feel that it is a stigma, and the mother can continue her breastfeeding to the baby. And the another aspect of breastfeeding here, the important one, is breastfeeding during natural disasters. So natural disaster is something which is unexpected, and we may have small newborns or preterm babies where they need to be breastfed. How we can manage. So breastfeeding is crucial during the natural disasters, and it also provides essential nutrition and protection against disease. So somehow we try to continue the breastfeeding. So we need to encourage the mothers to breastfeed. Here, as an emergency preparedness, we should prioritize breastfeeding, which including training of the persons who are engaged in the emergency. Okay, so we need to encourage them. There also we need people to help or support. So here also again the breastfeeding supporting group, the lactation supporting group helps us to encourage them to continue breastfeeding and not to stop. Why we are insisting on continuing breastfeeding even in disaster is because the breast milk is considered to be safe. It protects against disease and it is readily available. So they need not to search or go buy, prepare. So it is readily available. So we try to ask the mothers to continue the breastfeed. So that is also another important. And it also helps to reduce the infant mortality and emotional comfort. Even though there is a disaster, when the mother and baby are together, it itself will make the mother to produce milk, and that is enough for the baby. Some tips which we can help the disaster team or whoever is involved in disaster for promoting the breastfeeding is we should always encourage the mothers to continue breastfeeding. If they feel due to some reasons, if they stop breastfeeding, again secretion of milk will be affected. So somehow we have to encourage the mothers, provide her adequate support to continue the breastfeeding. So it becomes an important aspect over there. And hygiene precautions. So usually we focus more on hand washing, but since there is a disaster, we may not have adequate facilities for hand washing and maintaining the hygiene. At least whatever provisions are available, maybe a hand rub or something, we have to maintain the hand hygienes and continue the breastfeedings. Hand expression. This is for the mother who were using breast pumps, electrical breast pumps, but due to disaster, there may not be any electric supply, current supply. In such cases, we can encourage them to do an hand expression, express the breast milk. There may be certain situations where the mother used to express and give milk. So if that provision is not available, we need to encourage them to do a hand expression. Mother and baby should be staying together, which provides or encourages the breastfeed. And we also have lactation specialist healthcare providers during the emergency as a rescue team or as the people who are there in the disaster team will help the mothers to continue the breastfeed. So these are all tips which we can tell them to support the mothers. There may be some barrier for the mothers to breastfeed because they don't have adequate supports or because of environmental stress, because there she cannot expect a privacy, there she cannot expect a security because sometimes shelter may not be there, but mother have to breastfeed. So considering this, the mother may feel sometimes bad to support provide the breastfeed, but still they need to overcome this and then they need to breastfeed the babies. Now, when breast milk is not available, when they're not unable to provide breast milk, and there we can even take a chance of relactating and wetness. So here, maybe whoever has the breast milk, the other child can be given to the mother and mother can help in feeding the mother. We have donor milk. So take the mother and then feed the baby. Formula feeding. So we need to avoid formula feeding, but make sure that we get a safe treated water, then we can go for formula feeds. And we have to insist them of not to take all the donated formulas because we do not know whether it is safe or not. If it is approved by the controlled body authorities and it is safe, then we are allowed to give the formula feeds. So coming to the conclusion part of my session is to, as a take home message, this is a WHO guidelines. I mean, they have provided this as celebrating the World Breastfeed Week under the theme of prioritizing breastfeeding, create sustainable support system. The WHO and UNICEF are calling on governments, health administrators, and the partners to invest high quality breastfeeding support. That is the only thing. Even though we were talking about many things, still we need the breastfeeding support. Otherwise, it will not be we won't be able to achieve anything. So how are they trying to build up this high quality breastfeeding support is by ensuring adequate investment in equitable quality maternal and newborn care, including breastfeeding support services, increasing national budget allocations for breastfeeding programs, integrating breastfeeding counseling and support into routine maternal and childhood services, including antenatal, delivery, and postnatal care, ensuring all health service providers are equipped with the skill and knowledge required to support breastfeeding, including in emergency and humanitarian settings. I was happy when Madam Ruth told about they are training all the nurses for 18 hours of workshops to know. So it's very important. So in whichever situations they are, so they'll be able to help them, help the mothers, and they can manage the situations. Strengthening the community health system, Madam also spoke about all this health system to provide every new mother with ongoing accessible breastfeeding support to up to 2 years and beyond as a goal, as the WHO and UNICEF felt that it can be continued 2 years and beyond also. And protecting the breastfeeding by ensuring that all the international code of marketing of breast milk substitutes, because a lot of promotions are there now talking about the importance of artificial formula feeds comparing with the breast milks. So we need to make sure that it is being approved and then only it will be taken by the baby. So considering these are all the important points given by WHO. take the like considering this, we as a as a OBG specialist or an OBG nurse or a postnatal nurse working in an antenatal area or a postnatal area, we are able to encourage them. We need to tell them how to overcome the stress, how to overcome the stigma, and how to overcome the beliefs which is affecting the newborn. So we are playing a major role on that. So hope I have delivered my part. Thank you once again for everybody.
Thank you, Madhushila ma'am. Thank you, ma'am, for the enriching session. I would also take the opportunity to thank Mrs. Ruth and Dr. Sudha Reddy for their presence here on this online platform. Thank you, ma'am, for thank you to all the speakers for taking your time and your efforts in putting together the presentations in such a professional and enriching sessions. Thank you to all for being here this evening and attending this webinar.